All right, good afternoon, class. This is Dr. Hosni Amira. This is about physical agent modalities. The outline for this lecture, we will talk about Intro to PAMS, AOTA position paper and OT practice, superficial heating, therapeutic ultrasound, electrotherapeutic modalities, and we will talk about clinical scenarios. And in the class and in the lab, we will do hands-on with some clinical scenarios. We'll also do some checkoffs and possibly quizzes. Needless to say that this PowerPoint is a supplement, but it does not replace your any assigned reading. Physical agent modalities are interventions or technologies that produce a response in soft tissue through the use of one of the following five mechanical devices slash modalities. So the keyword here is soft tissue. As you apply those to the human tissue, the skin, the fatty tissue, the adipose tissue, the nerves, the blood vessels, the bones, etc., it will produce, PAMS will produce varying responses in each and every one of those tissues. And those mechanical devices or agents are light, such as infrared light, water, such as cold water, hot water, etc. Temperature, sound, such as an ultrasound, and electricity, such as electrotherapeutic modalities. So, classification of PAMS, it falls into one of the following four categories. Superficial thermal agents, those are heating or cooling modalities or agents that are cooled superficially, and then deep thermal agents, and then electrotherapeutic agents, and then mechanical devices. So superficial thermal agents are hydrotherapy, anything to do with water, cold water, hot water, heating, cooling, etc. Cryotherapy, which is anything to do with ice packs, etc., hot packs, paraffin, paraffin baths or wax, water, and infrared heating. So those are all superficial. Deep thermal agents modalities, the classic example is therapeutic ultrasound, and another one that we don't have written here is the shortwave diathermy. And those are modalities that produce heat deep in the tissue, uh, 3 to 4 centimeters, 2 to 4 centimeters deep in the tissue. So they go deeper than the skin into the tendons, the muscles, and joint capsules, etc. Electrotherapeutic agents are agents or PAMs that produce responses in the tissue through using electrons or electricity. And examples on that is biofeedback, neuromuscular and functional electric stimulation, transcutaneous electric stimulation, high voltage galvanic stimulation, and iontophoresis is one of the modalities that basically transmitting of medication uh, through the tissue using electric stimulation. So those are medication patches that comes with uh, medication particles that are electronically charged, and they will be transmitted through the skin into the tissue where the inflammation is, using uh, electric stimulation. Number four is mechanical devices, and those are devices that are mechanical, such as vasopneumatic devices. Think of um, anything that produces, for example, pressure on the lower extremities to prevent DVTs, things like that. Those are vasopneumatic devices. Continuous passive motions, CPMs, whether it's for the knees, for the shoulder, for the hand, and the rest for the fingers, and devices that produces continuous movement to affect joint range of motion, soft tissue mobilization, etc. Another example is compression, distraction, and such as in traction devices, vibration, the use of vibrators to affect scar tissue, for example, controlled mobilization to modify biomechanical properties and function of the tissue is the function of those mechanical devices. Um, Again, heat therapy involves applying heat to the body to increase blood circulation, or reduce blood circulation, also for reducing of muscles and to relieve the pain. Cold therapy is any cold modalities that are used to reduce inflammation, numbing of the area that is affected or painful area, to alleviate pain or inflammation, such as the use of ice packs, cold compressors, ice baths are some classic examples on cold therapy. Electric stimulation is the use of electric current to stimulate nerves, muscles, or tissues. The goal of that would be to reduce pain, muscle movement, muscle twitching, eliciting of movement in the joint. Tissue healing is another use of electric stimulation. Uh, and transcutaneous electric stimulation TENS is usually used for pain, and NIMS is used for producing movement in the muscles, such as, for example, uh, dropped wrist after a radial nerve injury. You hook up the NIMS onto the extensors of the wrist to produce movement, wrist extension in this case. Ultrasound is the use of high frequency sound waves to generate heat deep within the tissue and or to promote healing. So ultrasound does heating, generating heat, or healing um, by increasing the blood flow to the inflamed area, which allows for ionic exchanges and reducing of inflammatory factors in that area by opening up the cell, to the cell tissue and cell walls, allowing more ionic exchange and reducing inflammation. So heat, cold, superficially, electric stimulation to produce movement or numb the pain, ultrasound for heating or healing. The following three are light therapy, and this is the use of laser therapy or phototherapy for the use of specific wavelength of light to promote tissue healing and reduce inflammation and relieve pain. Hydrotherapy involves therapeutic use of water, such as baths, cold water, hot water baths, cold water baths, uh, to help with pain relief, muscle relaxation, and mobilization of joints, and mechanical devices such as massage, traction, etc. Now, in order to effectively use physical agent modalities, the therapist needs to be aware of their local and state rules and regulations. You have to know what is the scope of practice in your particular area, whatever state you're in. You also have to know your own hospital rules, the institution you work in. What are their rules and guidelines. You also have to know the reimbursement rules. If you're working with insurance, for example, it may be different than if you're working for Medicare. Most insurance will allow a rehab aid or a rehab tech to use modalities, and the therapist can bill for them. But if you're using Medicare, for example, which is a government insurance, they do not allow for that. Also, you need to know the OT assistant versus the OT roles. Who can write the goals? Who can determine the frequency and duration of the ultrasound machine, for example, and who can change it, and updating plan of care and frequencies and etc. So you have to know all of that. Also, we need to know that PAMS are an adjunct treatment that is used as a preparatory mechanism or preparatory treatment for interventions to enhance occupational performance. So the use of PAMS without occupational performance is not occupational therapy. Wound healing and pain management, if you opt for using ultrasound or electric stimulation rather, for wound healing, you have to be trained in wound healing and trained into electric stimulation. So you can know what parameters to set up and what type of wavelength, for example, or what type of parameters to set up the electric current to produce the debridement effect needed for that particular wound, and also to promote the blood flow to that wound. Same for pain management. It's also used for edema management, and the classic example is contrast baths. You dip the arm or the leg or the tissue in warm and then cold and then warm and cold, and it acts like an exercise like a vaso exercise by relaxing and contracting the blood vessels and the lymph nodes and the lymph vessels, and that would usually promote the edema reduction. Muscle weakness, obviously, such as in electric stimulation, loss of function. We use if there's a, breast extension difficulty, if there is shoulder subluxation, we use electric stimulation to enhance the strength of the deltoid, for example, for shoulder subluxation and for loss of sensation as well. American Occupational Therapy Association has a position paper that covers PAMS, and it's a good read. I encourage you to look at it. But in a nutshell, it says PAMS are considered as an adjunct method to be used in conjunction with purposeful activity. For example, if you work with somebody with a shoulder rotator cuff injury, for example, or adhesive capsulitis, frozen shoulder, you work with them. You do shortwave diathermy to increase the range of motion into abduction and external rotation. Biomechanically, that's great, but we also have to, have a manifestation of functional progress. For example, in order to improve dressing skills, for example, upper extremity dressing. So you work on the shoulder biomechanically, but the overall goal is to produce a purposeful activity or a functional improvement in dressing or grooming, etc. Number two is OT use of PAMS should demonstrate theoretical knowledge and technical skills for proper use and safe use. So not only we can copy a treatment protocol, but we also should be able to demonstrate, why it's working. Why am I using ultrasound versus shortwave diathermy, for example? So we have to understand how it works. And that's one of the difficulties with the PAMS in general. We cannot see how the electric stimulation is entering into the tissue or exiting the tissue, and how is it affecting, the distance between the electrodes. How does that affect the flow of the current within the tissue? It is hard to imagine if you don't have the theoretical knowledge. Number three, the exclusive use of PAMS as a treatment without application to functional outcomes is not considered OT. Just like we stated earlier, they can improve in shoulder external rotation, but what is the functional outcome beyond that for it to be considered OT? Number four, the safe selection and application of PAMS is not considered an entry-level skill, meaning that if you end up working in a clinic that you do a lot of PAMS, such as outpatient, hand, etc., you have to seek more training into PAMS. So it is not an entry-level skill. You have to do more training. All right, we will talk about conductive heat in the next section. So that's it for now.